Hello everybody, welcome back with a new topic. Our topic today is facies. What is the definition of facies? It is the appearance or expression of the face, typical of a certain disorder or disease. It is not defined as a face in terms of the anatomical region, and it's not defined as physiognomy. The facial features help to show the qualities of the mind or character by their configuration or expression. We will talk about the different facies with the different disorders, diseases. First facies we'll talk about today is the Hippocratic facies. They appear in severe and prolonged diseases. They are indicative of approaching death. In Hippocratic facies, there is concavity of the cheeks and temples. Nose is pinched, eyes are sunken, ears are cold and retracted, livid skin color. What about facies in cirrhosis? Jaundice sclera, pinched nose, shiny red lips. Facies in chronic obstructive pulmonary disease. There is chronic obstructive pulmonary disease type A and type B. Type A is with predominant emphysema, which is the pink buffer, and type B with predominant chronic bronchitis, which is the blue bloater. What about facies in nephrotic syndrome? The face is edematous and often pale. Swelling usually appear first around the eyes, and in the morning. The eyes may become slit-like when edema is severe. We will talk about facies in the autoimmune diseases. In scleroderma, systemic lupus erythematosus, dermatomyositis. First one is the scleroderma facies. Taut skin around the mouth, beaking of the nose, thin lips, described as river pirate mouth, masks-like face. What about the facies in systemic lupus erythematosus? There it is described as a butterfly or malar rash, normal colored nasolabial folds. What about the facies in dermatomyositis? The facies are described as a heliotrope rash. Facies in endocrine disorders. An example of an endocrine disorder, Graves' disease. Bilateral, slightly asymmetric exophthalmos, startled expression in the patient, widened palpebral fissure, infrequent and incomplete blinking, which is described as a still wax sign. Furthermore, there is another sign, which is the Rosenbach sign, is described as a fine tremor of the eyelids, and a Jelinek sign, prominent hyperpigmentation of the lids. Endocrine disorders, continuation, we will talk about the mixed edema, congenital hypothyroidism, acromegaly, and Cushing disease. Facies in mixed edema. Dull, puffy facies, periorbital edema, loss of lateral eyelids, called the Hertog sign, decreased mobility, dry, coarse, and thin hair, dry skin. What about facies in congenital hypothyroidism? We can notice hypertelorism, dental abnormalities, macroglossia, which is described as an enlarged tongue, clover nose. Furthermore, the facies in acromegaly. Bony prominence of the forehead, thickening of the nose, large ears and lips, prognathism, mandibula latita in gallus, inverse dental occlusion, and macroglossia, as we've mentioned, is the enlargement of the tongue. What about the facies in Cushing's disease? Facies of Cushing's disease are described as a round or moon face with red cheeks, excessive hair growth in the mustache and sideburn areas or on the chin. What can we see on a patient with facial paralysis in terms of peripheral lesion or central lesion? In terms of peripheral lesion, paralysis occurs to the entire right side of the face, including the forehead. Forehead not wrinkled, the eyebrow not raised, eye does not close due to the palpebral ptosis. Flat nasolabial fold, and we can also notice a dropping of the corner of the mouth. What about facial paralysis in terms of the central lesion? Paralysis in this case occurs to the lower part of the face when compared to the entire right side in the one for the peripheral lesion. In terms of the central lesion, the forehead is wrinkled, eyebrow is raised, eye closes, perhaps with slight weakness, flat nasolabial fold. We can also notice a dropping of the corner of the mouth, as also which occurs in terms of the peripheral lesion. Thank you for watching and looking forward to see you in the next video with a new topic. Thank you.